A warm welcome to everyone for this presentation. My name is Joanie and I'm a PhD candidate in nursing science in Lausanne University in Switzerland. And I'm really happy to give you today a quick look at our study on the implementation of discharge teaching intervention for older patients with multiple chronic disease. I won't surprise you by saying that in Switzerland, as most in Western countries, the proportion of older people suffering from several chronic diseases is increasing. Indeed, snowy mountains and chocolate do not make patients any less vulnerable to the risky period of the transition from hospital to home. And when insufficiently prepared for this transition, the resulting burden of combined health, mobility, functional, and social issues can severely threaten their well-being and lead to costly hospital readmissions. Teaching by nurses is really crucial to provide patients with the knowledge and the skills to self-manage their health at home. However, patient education is often left undone for several reasons, and in Switzerland, teaching patients is not part of the discharge preparation routine for nurses. So there is really a need to understand how nurses' behavior could be changed to improve the discharge process. In response to this issue, our pragmatic study aims at testing the feasibility of implementing a novel discharge teaching intervention that we developed to address the needs of older patients with multiple chronic disease. So this study is conducted in 3 acute care units with the participation of 13 nurses for the implementation part. And due to interruptions related to the COVID situation, the study is still ongoing in 2 of the 3 units. Of course, we all know that nurses' practices are influenced by organizational level policies and practices. However, we also assume that any intervention to improve discharge process would certainly fail without targeting a practice change at the individual level first. So for this reason, the behavior change wheel was used to support the design of theoretically underpinned strategies that aim to change behavior at nurses' individual level. At the hub of the wheel in green, you can see here the COMBI system, capability, opportunity, and motivation to behavior. That are the 3 components that generate a behavior. In yellow, you can see the theoretical domains framework, the TDF, consisting of 11 domains that explain the potential determinants of behavior and that are included in the 3 components of the COMBI system. And finally, the hub of the wheel is encircled by 9 intervention functions and policy categories. In our study, the TDF was used to identify first which domains influencing nurses' behavior should be prioritized in the implementation approach, but also guide the development and the selection of the different implementation strategies. To develop the implementation plan, we relied on the 4 steps methods proposed by French and colleagues. And these are identifying the problem, assessing this problem, forming possible solutions, and evaluating the selected intervention. I would like to focus on the 3rd step to give you an example of how the behavior change wheel can guide the development of the implementation part. Here, for instance, you can see on the left that education and training was a priori behavior change intervention that we chose. Behavior change techniques corresponding to this intervention were, for instance, giving instruction on how to perform the behavior. And using in terms of action also, for instance, verbal and written instructions. And on the right, finally, you can see that there is also really a need to consider any adaptation or development of new behavior change techniques depending on data collected regarding barriers and facilitators. So basically, this process is a way to ensure that the implementation strategies will be tailored to the units and nurses' needs and not only guided by the evidence. Targeted implementation outcomes for this study were any changes in behavioral determinants regarding the implementation of the intervention using questionnaires before and after the implementation phase, and also focus groups. Acceptability and appropriateness, and also the feasibility of the intervention after the implementation phase, the fidelity of the intervention delivery by nurses, and also the appropriateness of the implementation strategies for these nurses. Results of the pre-implementation phase. So here you can see the characteristics of the 13 nurses over the 3 units who participated to the implementation data collection. They have 2.5 years of experience in the unit on average, and regarding the questionnaire they had to complete, results of this questionnaire showed that the main barriers to teaching delivery was social political context, but also lack of support and resources from the organization, and also behavioral regulation, highlighting that nurses felt that they have little control over teaching deliveries, for instance, and also difficulties with planning teaching when patients are not motivated or when they have little time to do it. On the contrary, considering that teaching patients is really part of their professional role, and also the strong intention to deliver discharge teaching in the next months, were the most frequently reported facilitators to discharge teaching delivery. We also conducted the focus group at the pre-implementation phase to complete with qualitative data the barriers and the facilitators to teaching delivery. And if we take a look at what was said by nurses during these focus groups, we note similar results to the questionnaires regarding the barriers to teaching delivery, like resources and context or behavioral regulation. But we can also see differences between the units. For instance, beliefs in the positive consequences of teaching for patients are, for example, mentioned more in Unit 2 and 3 than in Unit 1. And conversely, necessary knowledge is emphasized more frequently in Unit 1 than in Unit 2 and 3. These results highlight the importance of really taking into account the specificities of the context in which one wishes to implement an intervention. And this required a rigorous process to be followed during such a study, starting here with assessing the problem with the TDF at nurses' individual level to understand barriers and facilitators to teaching delivery, and then forming possible solutions by linking the identified behavior determinants corresponding to behavior change techniques that are informed by the behavior change wheel to support the implementation. And finally, evaluating these implementation interventions regarding their appropriateness for nurses and also their efficacy on the targeted implementation outcomes. To conclude, implementing new practices in healthcare settings, such as discharge teaching here, require changes, of course, at the organizational level, but also in individual behaviors. Using the TDF provides theoretical basis for the implementation process, but can also guide the data collection, the analysis of factors that influence nurses' behavior for the success or the failure of the implementation, and also the selection of the implementation strategies. In that way, results of this study will help to address challenges often encountered when trying to implement in a real-world practice interventions that initially tested in highly controlled conditions. Thank you really for your attention, and I will gladly answer your questions.